Did you know that caregivers, the cornerstone of our healthcare system, provides 90% of community care? Frequently without being recognized. Explore how Team CarePal's AI-driven platform is reshaping caregiving, highlighting these overlooked heroes and their journey. Welcome to Provider's Edge, the podcast that helps healthcare entrepreneurs and innovators break down barriers and control their business, life, and future with valuable action steps. With me, your host, Sabrina Runbeck, a recovered clinician and a business deal catalyst. Let's rewrite the rules and create a positive social impact while increasing your profitability. Guess what? What I have here today is with Cindy Sim. She is the CEO and founder of Team CarePal, a company dedicated to supporting the millions of caregivers across North America. And she is the provider who cares for those of the loved ones. We know caregiving in itself is a job. And that's sometimes can be 24/7, whether it is for your family, for your partners, for your children, for your elderly parents, or even for friends. It is definitely a time-consuming, energy-consuming job that you have put that hat on. So for Cindy, she was inspired to create Team CarePal after experiencing the challenges faced by family caregivers while caring for her own family. So I so appreciate it for you to join us, Cindy, and tell us your story and the new venture that you guys have been creating. So congratulations for also winning the Health Tech Impact Award by Post Point Pass last year. Yay!
Thank you so much, Sabrina, for having me. I really appreciate being here and being able to share my story.
Yes.
I guess I can dive right into it if you like.
Go right into who are the primary population that you guys are focusing now, and how did you see the problem in the marketplace and to build this specific platform?
Yeah, well, interesting enough, up here in Canada, and this is a global problem, but how I like to start things just to get people kind of triggered into thinking is like, if I were to ask you what the largest group of healthcare providers are right now, you would automatically think nurses or doctors, but everybody always misses out that it's actually the family caregivers. We're the largest group of healthcare providers. They provide 90% of care in day-to-day care in our communities right now currently. And they are, unrecognized, a lot of times unsupported, unpaid. And these are family members like you and I looking after a loved one or friend with an illness, disability, aging needs. And aging needs, I say that because we have like the biggest group of seniors population. Our aging group is increased massively. And this group is hitting burnout. They are trying to manage not only the love of or care for their loved one at home, but they're trying to, manage their jobs and their family and their kids and everything else on top of it. So, our caregivers are getting sick as well. So, and this is really impactful. This is a crisis. So we decided to get to work.
Yes. By identifying the true problem, especially something that tied to our personal life, I think all innovators come out from that round is either you are an engineer with some expert talent in building a platform, but mostly what they build is still come from their internal drive versus someone like you who has that. I've been taking care of families, and even myself, when I was even in my middle school years, I remember my grandma got hit by a car. So then we have to take care of her at home. And many of us, it doesn't matter if it's aging or accident or just unexpected surgery, you have downtime. You can't do what you cannot do. And therefore, we need to be able to have our families, our friends to be able to look after us. But that also means taking away their time, their energy, and most people are still working. So definitely can be a burden, as you mentioned, that burnout issue. So when you're looking at the caregiver on the day-to-day, what have been the specific platform that you guys have built, what is that true solution that you are providing for all the caregivers?
Yeah, we dove into the market to validate what it was caregivers were actually using. And you're right, caregivers never plan to be a caregiver. It happens quite suddenly, overnight, a diagnosis, an accident. And then information is thrown at them from many different directions and different sources. And, they're still just mentally trying to wrap their head around, what just happened. And there was just nowhere that caregivers were able to manage it all. We went out there, we surveyed the market for about a year, and we dove in and we found that caregivers were using on average, 7 different tools to manage their caregiving role. They were very segmented, notes over here, in their phone, text message, and things were getting lost and they were very overwhelmed and they didn't know where to go for help or how to search for resources. And this was leading to burnout. And we know when caregivers burn out, their loved ones start to suffer. They end up possibly being institutionalized, rehospitalization starts to happen, things get dropped. So we went back to the drawing board after that year of validating what tools they were using, and we decided to put them all into one mobile application. It needed to be, user friendly. So these needed to be tools that they were already using because caregivers were already burdened. And so things, have that look and feel like a Facebook social feed where their family and friends can get together and support one another. There's your calendar that you normally use on your phone, messaging and those types of things. One of the biggest things in there, though, that we're really focusing on is leveraging the power of AI and machine learning. Right now, caregivers have no idea where to go for resources or support. So, we're leveraging AI to send them those customized supports based on their loved one's condition and their location, which is really exciting. So it'll be sent right to them in the application. The other thing that we're monitoring is their burnout levels. So, there's these great self-assessment tool in there where caregivers can monitor their burnout levels based on their hours of care they provide. We know, when a caregiver provides 5 hours of care per week, that might be totally manageable. When they start to provide that 20 hours or more, things start to really shift for the caregiver. And this is where they start to hit that burnout. They have to leave their job or go down part-time. They hit that financial insecurity and they themselves start to get mentally and physically, ill. And so based on these burnout levels, we're going to, again, leverage that AI to send them those, tips and tricks and supports for their mental health and send them those resources in their areas. And then, we got really excited about, all these cool little data sets in there because I'm like a forward thinker. I very much know that being proactive in our healthcare attributes to positive health outcomes, better quality of life, and it's just all in all cheaper. So, we did a machine learning feasibility study, and we learned that, with our data sets, there was some really great modeling we could do to pull patterns from. And so we're looking to be able to predict caregiver burnout and prevent it ahead of time. And so we launched that solution on the app stores last summer, which was really, really excited. So that was kind of phase 1 of Team CarePal. But yeah, we've just launched phase 2 as well. So we're really excited.
In this interview, we showed a future where AI and community unite to redefine caregiving. This segment unreviewed the stark reality of the caregiving crisis, highlighting the emotional and physical toll on caregivers. It also emphasized how Team CarePal's AI-driven platform is a beacon of hope, offering personalized, proactive support. This vision highlights the importance of leveraging technology to create a proactive and supportive environment for caregivers, ultimately leading to improved well-being, enhanced patient care, and a more sustainable healthcare system, and the strength found in community, which is enhanced by technology, providing a network of support and empowerment for caregivers. Hey there, fellow healthcare entrepreneurs. Reach out to me, Sabrina Runbeck, on LinkedIn. Let's connect and explore how we can elevate your healthcare business. Now, let's dive into the second half of our show. Yay! Congrats! So it seems like the platform both is be able to track how much caregiving you are providing and your mental status. So just like anybody, if we're not functioning at our best, then we're not giving our best. And we don't even have to give our best. It just gives something. So you can even think about the quality of care that you're delivering. If you're exhausted, you're not in the right status to be able to have that empathetic conversation with your loved one, they can sense it. They can sense the burden, the stress that you have. And then in turn, sometimes we know elderly people as well as any patients, they feel like I don't want them to be a burden. Therefore, they sometimes don't even want to ask for help, even though you're there to provide it. So definitely can be a double-edged sword if we're being caregivers are not actually in a place to provide the care we need to. And it's such a great idea for you guys to be able to track proactively for people to recognize the symptoms so they can take some proper self-care while they are providing care for others. Now, with your AI machine platform that allocate resources to tracking care and tracking the patients, what has been some of the biggest wins for you? I know everyone, right? As we build the entrepreneur journey, there's ups and downs. So what are some bigger wins that you guys have achieved so far?
Yeah, just the technology that is coming out in this space. I mean, it is a game changer. When we were first initially looking at doing the project, I mean, we've been working on this for a few years now. There was a lot more hurdles to go through. But, with ChatGPT and these new natural language processing coming out to market, making things super easy. It's just been very exciting. And, we have a lot of support up here in Canada, a lot of doctors, a lot of cheerleaders in our corners. So to build out the database has been challenging, but a lot more streamlined than what we could have ever hoped, because we know that this is such a pain point for caregivers. And it's not just like learning about, resources in your area. So we know that a lot of caregivers, especially with dementia right now, to know that there's, dementia, associations in your city or in your town is great. But a lot of people aren't, caregivers aren't educated as well. So we also get to train our Chat GPT model on some really cool tips and tricks for caregivers, like you said, to be able to look after themselves, but also for their loved one that they're managing. So we're hoping to really, really make an impact in this space.
That's amazing. So are you guys currently wanting to expand outside of Canada, or you already done that, or where do you think you guys are headed?
Yeah, absolutely. So our Team CarePal app is actually on the app stores globally. So if you speak English, you can download it. Because we knew that caregivers, there's a lot of long distance caregivers. Families are no longer just staying in one town. I mean, I have a brother who lives in Sweden. Like, we have families all over the place. So it was really important that all the families can come onto one application together to help manage the care of their loved one and actually support one another, and to kind of keep all of the aspects of care in one place. So we are definitely expanding into the US. Another thing that Team CarePal has done is we've set up navigators across Canada, and we already have some in play down in the USA. So if you're a caregiver and you're using our application, we'll be able to show you where there's navigators in your area that you can connect to, and they will help you with the next steps of your caregiving journey. So we're super excited about that as well. Again, it's really, this is such a crisis moment across the globe that it's an all hands on deck. And we really wanted to support all the organizations that are already out there doing amazing things. And we just want to connect them to our caregivers as well.
Exactly. There are so many people are fixing the issue with the care delivering system. So therefore, with the senior care longevity and caregiving space is growing bigger and bigger. And with our generational changes and people start leaving the workforce, right? The baby bloomers, and they do need to be cared for. And therefore, having a platform like you guys can really help them to find resources. Now, anything can have some challenges in a way. I'm sure you guys have seen common ones between the friends that you have encountered as well as your own. What are some strategies and you're able to overcome these bigger challenges, or something that you say, hey, this is the direction I hope everybody focus on so they won't get caught up as well?
Yeah, excellent. So we know one of the biggest challenges that we face with our mobile application is that, caregivers don't recognize themselves as caregivers. So, it's really quite hard to get that messaging in front of them. We really had to learn about caregivers in this space as to, really communicate them more on that level of like what their loved one is diagnosed with. If you're dealing with dementia, these are some ways, that our app can help you care for that loved one. So we really had to come at it from almost like an angle perspective to kind of grab their attention. They are busy, they are burdened. The other thing we kind of recently did, and because B2C solutions are quite difficult to scale. And we didn't want to put that financial barrier on caregivers. That has never been our intention. Caregivers, like you said, they're facing that financial insecurity. They're having to leave the workforce, go down part-time, or even just pull back their hours. They're taking on those extra finances and caring for their loved one. And so the idea that we would, charge them for it, it just didn't sit well with us. So after we did our health economic model last year to really showcase the effectiveness that we would have, on a healthcare system, on the caregiver's health and well-being, it was really interesting that came out of that. Like just as an idea, just here in Alberta, here in Canada, if we were to reduce caregiver burnout by 20%, we would save our healthcare system in this province alone $3.5 billion just in that year. It was interesting, like coronary heart disease kept coming up in women that had that extra burden of caregiving. Like it was really quite disturbing on how this really impacts health overall, not just for the care recipient, but for our beautiful caregivers. But the other side of thing, you talk about like the employment piece, and I'll kind of touch on that. We started realizing, with our health economic model that we can actually showcase the effectiveness that we could have from an employer standpoint on their organization just by providing Team CarePal to all of their employees. So we can customize a model to showcase the effectiveness we have as far as like how many, hours we can retain for them, how many employees we can, or how many hours of productivity we can get back, and how many employees we can retain for them. Because you're right, like we are talking about our biggest group of in the workforce is about to retire. So not only are we losing that group, but now we have to care for that group. And our healthcare system is already finite. Resources are thin, and it's really going to land on, us to look after them. And this includes employees or employers. So if they really want to, keep their employees, they're going to have to start paying attention and start offering some supports. And Team CarePal is a great option.
We explore deeply into the transformative power of AI in revamping caregiving. This piece explores the multifaceted challenges caregivers face, from the emotional toll to the physical demands, and how Team CarePal's AI-driven platform offers a beacon of hope. By integrating technology with human connections, Team CarePal not only provides personalized support, but also fosters a supportive community, setting a new standard for caregiving. This blog encapsulates a future where technology and community work hand in hand to empower caregivers, ensuring them thrive in their roles. If you haven't done so already, subscribe now for the latest insight and actionable tips from our expert guests. Let's rewrite the rules for your business and create a positive impact in healthcare. Back to our show. So what I'm hearing you say is that your primary market resource is connecting with larger employers to be able to support that. So then individual caregiver doesn't have to pay out of pocket. And a way to subsidize the platform's cost is employee benefit. And as they can list out on keeping the amazing employees that they have so they don't lose it into missing extra amount of days to take care of their family. And now your entire workflow for that person is in a gap and everybody else have to take it on. And we know replacing an employee is very costly in itself. So that seems to be a great point for you guys to tap into. Any other organization that you have thought about in be able to subsidize the revenue generation side?
Yeah, excellent question. And so when we launched our beta, because we were working with a lot of stakeholders, our solution is very co-designed by caregivers and our stakeholders. So we had a lot of beta, we had a lot of discussion with a very diverse group of people. I mean, home care companies, long-term care companies, everybody in this space space from even churches who are trying to connect with their homebound members. This touches everyone. Like we know 1 in 4 Canadians right now, and I know the same down in the US, is a caregiver. And in less than 10 years, it's going to be 1 in 2. So this is impacting every single space. So when we got together and talked to our stakeholders, we launched our beta, we gave them our app, and because they wanted more than just to share it, they were needing to connect to caregivers. So currently right now at this time, especially up here in Canada, we didn't even recognize caregivers in our healthcare system. And so, that's starting to change now. We need to start implementing that and bringing caregivers into the care team. And so, we launched this beta, we gave them our application to all these, different organizations and said, like, if we could build you out a platform, a software, that would connect to the app, what would you use it for? Like, how would you support families and caregivers? And it was super cool. They gave us an incredible amount of feedback on all these different features. And so we literally built this caregiver management relationship system where any organizations, if you're to look, say, at the long-term care space right now, we know that caregivers are still providing 30% of care, even in long-term care. We know up here in Canada, our long-term care is finite. Like in Saskatchewan, you're not even going to get a bed. So the wait lists are massive. That now they're starting to do these day programs to, because a lot of places, a lot of people have, that loved one with dementia, 80% of them are, and there's nowhere to put them. And so long-term care homes we have in Saskatchewan can use our CRM to provide families with the application, and they can connect to them and bring them into the care planning and monitor their burnout and help support them with resources. They can survey them. They can use things like social prescribing, which is huge. They can help navigation-wise. Like there's just so many great and beautiful ways to connect to families and support them. The other pain point is, when a loved one leaves the hospital and gets discharged. More often than not, they are now being discharged earlier and earlier. Our hospitals are full. And the loved one ends up going home. And without that extra support that you can give the family, that ends up being in a re-hospital admission, like they end up back in the ER. Infections, like things just get missed. Medication doesn't get, inputted properly. So, it's really a space that, our CRM fits into a lot of different ways. And we're super excited to do all these different pilots and start to measure these health outcomes. So we are expanding our health economic model to showcase the effectiveness that we would have in a healthcare setting, like connecting nurse practitioners to family to help monitor, from a remote way. And there's just lots of really cool different things going on. So that's another solution we just launched a few weeks ago. It is on our website. We have a lot of solopreneurs in that space that we really support. That do a lot of like coaching with caregivers and have memory cafes, or they work with big groups of families that have a loved one with dementia. And a lot of them, provide their own kind of courses and whatnot. So they can actually implement and send these courses through the CRM right into the caregiver's application. So it's a super fun tool that we've created.
Yes, I definitely hear you on the piece of transitional care. And I still practice medicine in cardiothoracic surgery 1 week out of the month. And we get dinged, especially a big program. We get dinged if people come back to us within 30 days after discharge. And sometimes it's because improper education, they have no idea. They're not monitoring their vitals at home. And they just thought, oh, I'm just taking the medication and not thinking, actually, I do want you to check your blood pressure twice a day. Do you remember, or the caregiver have to remember? Did you track what the number is? Did you have a system that some of them are great at Wi-Fi or Bluetoothing the data directly into a caregiver tracking system and remote monitoring system? In the US, the government also supports that round. So what I'm hearing is amazing things of the government level is supporting both our caregiver and patients from that remote side. Now is really about how to better leverage these technologies for all of our caregivers and our patients. And knowing that there are many solutions, find the ones that work best for them, best for us, so we can continue to work the best, show up as a valued member of the society as we carry out our professional work, as well as someone who has this amazing relationship with your own family, your care ones, because they're sick. And then sometimes it doesn't even have to be acute illness. It's these chronic, the mental health ones you talk about, and these chronic disease with diabetes, hypertension, all these things that people are struggling. And sometimes if we're not able to capture that early, that's when things fester into something bigger deal. So as we all need these community support, how can our audience who are healthcare leaders listening to the podcast be able to support you guys?
Yeah, currently right now we're looking to do pilots. One of the barriers we face being, a for-profit up here in Canada is that, the public system and non-for-profit system doesn't necessarily like to play nice with a for-profit system. Canada's great for, doing pilots and grants and everything, but they're very slow to integrate these amazing solutions into the care plan. And then we also face as another barrier is, the overwhelm of hospitals and, healthcare organizations. And this is a global thing. We talked Australia and UK and whatnot, and this isn't just in Canada. This is all over. So, we're really looking for that healthcare system or healthcare organization that is really wanting to change the game, like you said, on being proactive. Those are the people that we want to meet with, talk to, and lay out plans with, and measure those health outcomes, and look at the data that's already been done. Like we know, even just by doing like frailty assessments regularly, through Team CarePal in the community, we can catch those things really early on and implement rehabilitation very early. And that's going to prevent a lot of negative health outcomes down the road. So that's, who we're really focusing on working with is those that are ready to be proactive and actually, measure the data and create a solution that will actually be sustainable.
Exactly. Everything is about sustainability, not just a quick solution that may be working today, but what about next month, next year? We have to be able to have something that we can use over and over again. And that system has to continue to adapt with societal, environmental changes to be able to support all of us. So I so appreciate you, Cindy, for sharing your amazing platform for both the prevention and burnout for caregiver to go to the resources, and now helping really thinking about employment, right? Like how do we serve people for that continuous support? You're not even all the entrepreneurs who have hundreds of employees. How do you keep them satisfied? To the individuals who perhaps you have a small to medium-sized business and you only have a few people working with you, you definitely cannot afford to lose some of them or yourself getting out of the work and not able to support your family.
Absolutely.
So how can people best find out more about you guys or having a conversation?
Yeah, you can contact me directly. My email is cindy@teamcarepal.com. You can check out our website, teamcarepal.com as well. There's an incredible amount of information there. We're, I think, on all the social media channels. Just reach out to us. I live and breathe this. This is what I do, and I'm not going to stop until we've made a huge impact. So,
as the silent epidemic of caregiver burnout escalates to crisis level, a beacon of hope emerges. Could AI be the pivotal change needed to reshape the caregiving landscape? Today, we discovered how Team CarePal is at the forefront of this significant shift. Here are the 4 key points we discussed. Number 1, caregiving crisis. Millions navigate the complexity, often overwhelming world of caregiving, facing emotional, physical, and financial pressures with finance support. Number 2, AI to the rescue. Enter Team CarePal, an AI-driven platform offering personalized, proactive support to caregivers, revolutionizing the way care is managed and delivered. Number 3, beyond burnout. A vision for future. Team CarePal isn't just fighting burnout, reimagining caregivers' future, where technology predicts and prevents the challenges caregivers face. Number 4, the power of community and technology. This movement is more than an app. It's a community where caregivers find connection, support, and strength, powered by the latest technology and innovation. Now, we invite you to share your experience and insight with us. Post on LinkedIn, tag me, Sabrina Runbeck, and let's engage in a dialogue that could steer our collective success toward a more prosperous and efficient future for both caregivers and those they support. Now, what role do you see technology playing in reshaping the future of caregiving? Thank you for tuning in to Provider's Edge podcast. We hope you enjoy our latest episode and found the insights and tips helpful. We'd love to hear your feedback on the show and learn what topics you'd like us to cover in the future. So please take a moment to leave us a review on your favorite podcast platform and let us know what you think. Your feedback is essential to help us improve the show and provide you with the content you need to take your healthcare business to the next level. Thank you for your support, and we look forward to hearing from you soon.